Watch this transformation of varicose veins happen in real time. This is a live varicose vein procedure. No major surgery, no cut, no stitches, and you are going to see exactly how it works. I am Dr. Sumit Kapadia, and as a vascular surgeon, having treated more than 10,000 patients with varicose veins, in the next 6 minutes, I'll show you how we eliminate painful bulging veins using laser and sclerotherapy. The same procedure I perform daily for patients suffering from varicose veins. If you know someone struggling with varicose veins, share this video with them right now. And do hit that subscribe button so you never miss real patient procedures like this. Let's get started with what you are seeing on screen. The patient's leg before treatment, you can see that bulging rope-like veins. And you can notice how they are bulging and twisted running down through the leg. These are classic varicose veins. They are enlarged because the valves inside have failed. And when valves stop working, the blood collects down due to gravity. This causes the symptoms that patient describe to me every day. Heaviness and fatigue, swelling especially by the end of the day, sometimes night cramps that wake you up, itching and skin irritation. And sometimes it can be embarrassment when you're wearing short skirts or shorts. But look ahead. The darker patches that you see near the ankle, they are skin damages which have happened due to long-standing venous reflux. And if ignored, this would progress to non-healing ulcers that just won't heal. Many patients still come to us at this stage because they have no awareness of what are the stages of varicose veins. Do you have these bulging veins in your leg? And if you want my personalized advice, do click join to join my vascular health membership community. But don't worry, free content stays free. Let's move on. Before any procedure, we perform a detailed duplex or Doppler ultrasound mapping. That is what helps us separate modern vascular treatment from old-fashioned vein stripping or surgery. Normally, veins show blue color, which is a forward flow. But when we ask the patient to do a Valsalva maneuver, it shows red, which means there is a reverse of blood flow. We then mark the entire leg with surgical markers to know which veins will need the correct treatment. The entire treatment is going to be done under a Doppler guidance. This marking and ultrasound guidance is critical because varicose veins sometimes may not be just visible on the surface. Some may lie deeper, and treating only visible veins will not solve the underlying problem. Proper mapping ensures that long-term results and it prevents recurrence. That's why ultrasound guided treatment has a 95% success rate as compared to the older surgical methods. Now the first part is to numb the area with Tumescent anesthesia. Here we can use a combination of local anesthesia with a nerve block because when we do a laser, the entire vein will have to be given an anesthetic. Here we are giving Tumescent anesthesia injection through multiple small injections along the vein path. This local anesthetic is mixed with saline, which helps to create a protective fluid cushion that numbs the area and also protects the surrounding tissues from thermal damage. During this procedure, the patient can be fully awake, comfortable, and relaxed. Usually, general anesthesia is not needed unless we are going to treat any other veins. Many people assume that laser treatment is done from the surface and nothing is given inside the vein, but this is called as an endovenous laser, means the laser fiber is actually going inside the vein. Now here comes the most important moment. If you watch carefully, this is where science becomes visible. The laser fiber you can see entering through the needle into the vein and we pass it till the junction. This entire procedure is done under an ultrasound guidance and we can see it on the screen as a bright white line traveling inside the vein. The fiber travels from the puncture site to the saphenofemoral junction. Usually a segment to 30 to 40 centimeter of vein is treated when we do laser. Laser energy firing is sometimes seen as a visible bright flash on ultrasound. The vein walls immediately start shrinking and collapsing. We gradually withdraw the laser fiber as the vein seals behind it. The energy from the laser heats the vein walls to almost 120 degrees Celsius. This causes the collagen in the vein wall to shrink and the vein to shut down instantly. This entire process is called as Endovenous Laser Ablation or EVLA. The sealed vein will no longer carry blood, So your body naturally redirects blood through healthy veins. You have plenty of backup circulation options in your legs. So what you just witnessed is the science behind the dramatic results, and we'll show you a few patient photographs of how the veins can be permanently shut down without an incision and the result that we get from doing laser. The entire laser ablation takes somewhere between 10 to 15 minutes per leg. Pause the video and rewind if you want to see how the laser is working again. That's the exact moment everything changes for the patient. Now that the main leaking vein is sealed, we move on to the next critical step, which is sclerotherapy or treatment of the branches. Once the main trunk is closed with laser, it is time to treat the side branches, which are the bulging twisted veins you saw prominently at the beginning. Now, if they are very large, we do something called as a hook phlebectomy, but for other veins, we do an injection sclerotherapy. And this is how we do that. Here you can see we are puncturing the vein with a very small tiny needle, and through that we inject this special solution, which is a foam sclerosant. This causes irritation of the vein wall, leading to sclerosis and closure of the vein. The same sclerosant injection can be repeated at multiple locations depending on where the veins are visible or seen on a color dot. So this is why the combination treatment is so powerful. Laser fixes the root cause deep inside, and sclerotherapy clears the visible branches on the surface. Now look closely at a few of these side-by-side comparison of before and after images of some of the actual patients we have treated. And when we say that varicose veins have to be treated properly, these are the results that we would expect. Some patients may note redness or bruising where the laser treatment or sclerotherapy has been done, but that usually recovers within a couple of weeks. So recovery is remarkably simple. We recommend wearing compression stockings or bandages for a few days to support healing. But here's what surprises most patients. They can walk just a few hours after the procedure. They can return to work in a couple of days, and they can instantly resume their normal activities. No absolute bed rest is required. The symptoms do show improvement in a week or two, but the visual impression, most patients will notice that their symptoms will reduce within the first 1 or 2 weeks. But the cosmetic or visual improvement may take 2 to 3 months as the veins fully dissolve. And most patients are quite happy by the end of the 2nd or 3rd month. So remember, laser and sclerotherapy together offer one of the most effective treatments for varicose veins today. It's minimally invasive, safe, requires no major cuts, and delivers long-term results when done with proper planning and doctor guidance. So if you or someone you know has varicose veins, early treatment can prevent serious complications like skin darkening, bleeding, or even non-healing ulcers. 3 things before you go. Share this video with anyone suffering from varicose veins. Subscribe if you want more real patient procedures to be seen, and comment your questions below. I try to reply to every single one. I am Dr. Sumit Kapadia. Take care of your vascular health, and I'll see you in this next video.